how does the life of a dentist, as you have worked here also, India also, and Australia also, how does it differ? What are the things which you found it completely different in Australia?
It is very different in the aspect. So, how the best part that I used to love about India is that you can have breaks in between. So, you would work from 9 to 2 and then you have 1 or 2 hours, not 2 hours, but you have quite a lot, some few hours break and then you come back. It's not the same here. When you start at 9 o'clock, you have an hour lunch break, but you still be in the clinic itself. And then if there are patients, you have to see the patients. It's not like, your lunch break is never fixed. It can be 12 o'clock, it can be 3 o'clock as well. And then you get done by 5 o'clock. Usually that's the time. So these are long. I feel it's more tiring here because the worst part for me is, we are so used to talking in our regional language and the certain acts of doing certain things certain way. Yeah. But here it's like you have to follow a particular particular custom, the way you talk, the way you're always welcoming, you're always smiling, and you're always courteous, and you're always so many things. So you have a lot of pressure on yourself.
Okay.
And you have to do a lot of talking.
Okay. Like in your clinic, wherever you're working, there, do you have more of an Indian population or the Australian, or how is it?
No, it's mostly Australian population. The place where I'm working, the patients are lovely. They are so beautiful, like amazing patients, and that is one thing here as well. I've seen, like, it is just a general rule usually that you're just very polite to each other. That's how it is. Very few times that I've come across with a very rude patient. They are very polite, very nice. But mostly the place where I'm working, it's all Australian. I had a lot of trouble understanding the Australian accent in the beginning. I was really struggling with the Australian accent because it's very different to even the normal, the US accent. But then, yes, you get used to it. It's fine. Okay. Sometimes if you don't understand, if they laugh, you just laugh. That's it.
The emotions and all जो है वो तो same ही है.
Yes, the emotions are the same. You understand that, okay, he tried to make a joke, so you laugh. Or sometimes I even have my nurses once everything's done, I'll ask them, what did he just say? And they'll explain it to me. So I was like, oh, okay, fine.
I would really want to ask you one main thing, is that if any young dentist is planning to come to Australia, what advice would you give?
Oh, just be confident. You have got it. Trust me. Easy to do. The best part is the way we are trained in India. It is really good. Any college you take. I have been so blessed to have that training and the knowledge that the way we have been given, and it has helped me all through. So if you have your basics clear, there is nothing to worry about. Here, they don't want the extra knowledge. They don't want you to show how much you know. They just want you to show, and they just want to know that you know the basics. That's it. The basics. Very, very, very basic. That is it. Nothing else. Nothing else at all. Yes. So, and we know it. Every dentist who's graduated from India knows it. So, yeah. Just be confident. That's it.
Awesome. That's the best advice, because everybody, has this dilemma in their head before going there, that how are the life there. That is something which is very important, and the first thing that comes to your mind कि पता नहीं कहाँ पे कैसा है, job है कि नहीं है, because जो भी हम लोग search करते हैं, it need not be the updated one, right?
Yes.
But talking to you, and जब आप totally अभी का current scenario बताते हैं, it will be really helpful to the listeners. जब उनको समझता है कि okay, there is need, हम कर सकते हैं, okay, it takes some time, 1.5 to 2 years हमें time frame mind में रखना पड़ेगा. These are the things which are actually very crucial and very important, and it will help a lot of dentists. So thank you so much, Darshika.